Hello everyone, and welcome back to join us in on today's topic. Today, we are here to talk about what is the right age to start and stop massaging your baby. Baby massage, as we all know, is an age-old tradition in India. Many of us may have been told that babies should be massaged from day one. But let us pause and reflect. Are they too delicate and sensitive on day one to receive this kind of stimulation? We also hear that we should massage our babies for the first year. Does that mean we stop giving them massage after they turn one? So let's get some insights on the correct approach over these things. So let's get started, Jyoti, and we would like to first understand, should babies be massaged from day one?
Well, Alpa, yes, this is something that we hear a lot that, as soon as babies
Yes,
are born, we should massage them. That's very commonly told to people. Uh, However, that is, in our view and recommendation, that is not necessarily the right thing to do. When babies are born, most of the systems are immature. Their skin is very delicate and porous, which means, they absorb things more easily. Their sensory receptors are not fully, developed. So basically, the
hmm,
skin is immature, their circulatory
right,
system is immature, their immunity is immature. So they are not able to digest and process and the stimulation or the inputs that they get in the same way that an older child or an adult can.
hmm,
Therefore, it's important to understand that babies should not be massaged from day one. Having said that, it is very important to note that babies need our touch from the minute they are born. We are talking of two
okay,
different things. One is nurturing touch, where we are giving
mm-hmm.
them, providing them with a lot of comforting holds, skin to skin, and then over time baby wearing, cuddling, all those things. Yes, we need to provide to our babies right from the beginning. What we are talking about when we say massage, most people understand massage as a series of strokes
Right,
and
yeah,
techniques like the ringing, the gliding, etc.
hmm,
Those all should be started from week 3 or later, not before that. Before that, just a gentle rub on the head or the back or the bottom or the stomach, or gentle exercises along with your cuddles and holds and skin to skin. That's what is needed. But massage should ideally be started only after one. Of course, the umbilical cord has, fallen off, the area has healed, and then after 3 weeks.
okay, okay. That's great to know because what we hear constantly makes us believe that start massaging the baby from day one. So yeah,
Yes.
that was clearly understood now. And also, what's the right time then to start using oil for massages?
In the similar context, babies are not yet ready to receive so many inputs. Their system is not yet ready to process. So even a mom's, the breast milk also changes along with the baby's growth, right? So
Hmm.
right in the beginning, we do not need oil. In fact, doctors ask us also not to bathe our babies with harsh soaps and shampoos. So we have
Yeah.
to give our babies some time to acclimatize to this environment. So we recommend you a pure oil only after, pure vegetable based oil only after week 3 when you start massages. Before that, you can be without oil. Actually, we are not massaging them. You are just doing exercises. We are doing belly rubs, so we don't need oil for that. We can do all this stimulation on top of their clothes. So we
Okay.
do not use oils also before 3 weeks of age. And actually, Alpa, let's have a separate session and oils and talk in detail about them, because we also do not recommend using essential oils, herbs right from the
Yeah.
beginning. So that we'll keep for
Yes.
another day. But to answer your question,
Okay.
3 weeks onwards.
Okay. Okay. Got it. Now, the next thing is we hear from many parents who have attended also our classes and their babies were born prematurely. So they were recommended to massage their babies vigorously and as much as possible so that they can catch up with the growth and the developmental milestones. What are your thoughts on this? And are there any special considerations for babies who were born prematurely?
Well, it can be very tempting to massage a baby, when they are born prematurely, because we want to do as much as we can to help our baby. So, that, oh, massage is good for the baby's growth and development, so let me do that because I want to help my baby. But is it really the best for the baby? Well, a lot of times babies born prematurely spend more time in neonatal ICUs, where their days can be
Hmm.
filled with medical interventions and other type of various people. Someone will come and do some procedure, some treatment, some light, etc. Okay. uh, there is hardly any time or rationale for doing massage in the neonatal NICUs. That is evident. There are grower nurseries where, only after babies have reached a certain amount of medical, uh, and we still continue babies goals in mind. Now, what are the baby's
Hmm.
goals? The baby's sleep is important for them, for their growth and sensory development, because they very rapidly at this time. And they're very brief opportunities that baby can give you, because understand, massage the baby, it takes energy to receive this stimulation and process it. So they may not be
Okay.
able to handle this extra stimulation. Their skin is also not able to handle this extra stimulation. However,
Mm-hmm.
babies born premature do benefit from a parent's proximity and touch, or from, comforting touch and nurturing touch, etc. So parents can begin a slow and sensitive introduction to holding their babies, time with their babies. In fact, we have a 5 step approach, where, we help parents understand. They observe and prepare for touching their babies. They seek the non-verbally seek the permission. They recognize and respond to the cues that a baby born prematurely may be giving out. For example,
Hmm.
if a baby starts sneezing too much or hiccuping, in a baby who is born prematurely, or a baby who, they, it may be a sign of overstimulation. So there are things like that that parents need to be aware of. It is important. Touch will help them, but please understand that their goals are different. We are not helping them by overstimulating them with massage. So we have to
Hmm.
approach this very gently. We have to get a clearance from their medical staff that it's okay. But yes, touch does help our babies. So very sensitively we have to hold them only that much that they are able to accept and handle, and then from there we slowly progress with our journey and prepare them for massage over the following weeks or
Right.
months.
Right. Okay. So then let's move on to my next question is about as the child grows, like we have started massaging the baby after 3 weeks as per the recommendation. And now the baby is grown, like she is able to sit or maybe she is able to crawl. So do we use the same massage techniques which we used when the baby was newborn? We continue using the same methods, or is there any difference in the approach, how we massage the baby as the baby grows?
See, Alpa, like we talk to parents in our classes, we tell them that, see, when so many things about the babies are changing. Their food, they're growing, right? So their needs are changing
Yeah.
as they grow. So in
Yeah.
touch, and the way we them, their needs are changing. They are in a different phase, and we need to adapt to them rather than trying to adapt them to a massage that we want to do, which they don't
Hmm.
understand. That becomes a struggle, and many parents. So, there are some pointers that we can share here. For example, when you start at 3 weeks, you will start with a limited amount of time. You will not try to do a very long massage. Um, as you move, as the baby is 3 to 6 months, you will find now you get a good window to massage your baby, because now their behavioral states are a little more stabilized. They give you a little more time to massage you. But yes, as they start turning, you may find that when you put your laid your baby down on the mat to massage, when they have reached a certain age, they like to turn, they like to put their head out.
Yeah.
What do you do?
Hmm.
So we recommend to parents that adapt to it, make a game out of it, or put cushions in a way that if the baby's head falls down, the baby doesn't get hurt. It is a normal milestone for the baby to turn. It is also very good for them to get tummy time. So we
Yeah.
have to work around also. So if the baby is turned on their tummy, let's work on the back. Let's finish the strokes on the back. Let's do the legs from the back. And then when the baby starts crawling, maybe make a game out of it, pull them back towards you, or make them sit in your lap in the middle of your legs and then massage them, so that you're
Hmm.
giving them a boundary and they can't escape. So when once they start sitting, and they like to sit a lot, they sit up, maybe give them a soft toy or a book. You uh, you know uh, uh, when massage them at nap time, or in the evenings for longer, or in the bath as long as it's safe. So there's many ways. Or tell them a story, make it engaging. Or find a time when they are not as hyperactive or not full of so much energy, that you can engage them. So there are ways to do this, to engage with your
Hmm.
children, when you can work with them. Let them be in the position they want to be, and you can still make it fun for them, and you can still make it a meaningful massage. So many of us get a massage while we are sitting. We may get a head massage or a neck massage or a foot massage. We get massages at airports with our clothes on, right? Those are also
Yeah.
equally effective. Oil is not used at that time when somebody works on top of our shirt, when we are sitting on a getting a seated massage. So these are options that
Yeah.
can work for kids as well. So no, we will not be able to massage them in the same way. We will not be able to massage them for the same amount of time. All those things will change over time. And yes, we do cover it during our classes, like when the baby is this old, how long can you massage, or when they are so many months old, how long can massage, and how can you go about things. So yes, it changes.
Right. So babies are smart, and parents also need to, make smart decisions and adapt to how, as per the needs and requirements of the baby. Right.
Yes.
Okay. So another thing is, what we started with, like when to start and when to stop. So we know that we all hear that massage is compulsory for the first year. So does it mean you stop massaging after the baby turns one? What's the right age to stop massaging your baby?
Okay. So, we are told that the first year is very important for a baby's development, and that is very true. In fact, the first 3 years are phenomenally important for a baby's growth and development, their brain development. So,
Yes.
we can really help turbocharge these years with our touch and massage and supporting them with their growth. For the first year, absolutely yes, if we can manage to provide our nurturing touch and massage as often as possible, like every day, then great.
Yeah.
But do we need to stop after that? No, even beyond that. You know what happens is, why we stop is because we find it challenging, because we have not been able to understand how to adapt to our babies. It really becomes a struggle with the babies, and it's difficult to continue when we are, the babies are crawling, walking, and
Yeah.
crying when we try to massage them. So as long as we
Mm.
can understand that and work with them, it is very important for them to continue to receive this touch, this comfort, this security from their parents. So if you can continue to massage them 3 times a week, even when they're 2 3 years old. After that, as they become preschoolers, if you can do it twice a week, you don't need to do the full body, maybe just the legs, maybe just the head, maybe just the shoulder. And similarly continue that even into their tweens and teens. Well, I was just reading the other day the amount of the youth, that is amount of the number of youth who are depressed and feel cut off and isolated, and the number of
Yeah.
children who feel isolated, and they feel they are actually, because this whole social system, the fabric has changed. So where there used to be a lot of people in homes, now there are not those many people in homes, and children are also leaning on digital devices. So it's very important to continue as long as we can. Even as an adult, many of us still find massages relaxing. So there's no really stop by date for massage.
Right, right. So as adults, we all also enjoy massage equally. So I can totally relate to, like, there is no right age to stop massaging, and one can always adapt
Exactly.
to the circumstances.
Yes,
Great.
and we need to
Thank
understand
you.
their age and their emotional and mental space, and word ourselves, give them choices according to that, and give our massage according to that. To a teenager, of course, we are not going to give a full body massage or anything. We may just do a foot massage, or we may just do a hand massage, right? So we adapt.
Yes. So I think we can conclude by saying that learning baby massage is a lifelong skill in a parent's toolkit. Once you start massaging your baby and experience the benefits firsthand, you may find that both you and your child want to continue this therapeutic and bonding interaction well into teenage years and even beyond. At Kyola Wellness, we offer baby massage classes for expecting and new parents. Do check out our work and what some parents say after attending our baby massage classes. Thank you for joining us today. In our next circle, let's talk and understand about what time of the day and for how long should the baby be massaged. Thank you, Jyoti. Thank you, everyone. Bye and take care.
Thank you for watching. For more such videos, do like, share, and subscribe to the First Parents.